Hello, and welcome to the New Normal, a series of virtual discussions intended to help us get out of our comfort zones and debate different perspectives of the future. My name is Todd Terrazas, and I'm your host. On this episode, we have Bhaskar Krishnamachari giving a talk on mobile contact tracing technologies for COVID-19. Dr. Krishnamachari is the director of USC's Viterbi Center for Cyber Physical Systems and the Internet of Things. He's also a professor of electrical engineering and computer science at the University of Southern California. Following his talk, we will go into breakout rooms for 20 minutes. Afterwards, we will return to this main room for an open discussion. If you're watching this on YouTube, you can join us in Zoom by visiting thenewnormalseries.com. Now, without further ado, here is Dr. Krishnamachari.
Hello. I'm going to talk today about privacy-sensitive mobile-based contact tracing for COVID-19. So we've been seeing scenes like this in the beaches in LA. This is Venice Beach this Memorial Day weekend. And it's clear that the public is eager to get back to normal. We see a lot of economic and political pressures to get back to work. At the same time, if you look at the number of confirmed cases for COVID-19 in LA County, it hasn't quite started to decline yet. And the question that's been on my mind is whether targeted interventions that are needed could be aided by the use of contact tracing. So let's start with kind of what is contact tracing. This really goes back to the 1930s. It's originally credited to Dr. Thomas Parent Jr., who was the Surgeon General of the United States in the 1930s. And it was developed in the context of syphilis. Essentially, it's a way of tracing back individual cases, right? And tracing forward who these people that are infected have come into contact with, that have also developed the infection. And by being able to identify this series of contacts, we can hope to contain and mitigate the infection. And in the context of COVID-19, we've seen such efforts being done in Singapore, for example, where they've had a really impressive effort on manual contact tracing by having caseworkers contact individuals and identify who they've been in touch with, and make all these links and identify the places that have been the locations where a lot of these infections have spread and so on. And you can see on this website, for example, the contact graph of individuals that have been sick and who they've infected and so on. Our own interest at USC has been for many years in looking at how mobile technology could be used to aid such efforts. In fact, there was a study we did back in 2008, 2009, where we handed to a class of about 25 freshmen these wireless mobile devices that would log when these devices were within range of each other, and then the students that are carrying them when they are close to each other, who met whom, when, and for how long. And with this type of data, you can actually build potentially some interesting models and study how epidemic propagation might take place. So in the context of COVID and contact tracing and digital contact tracing, various countries have deployed apps. You hear of such apps in China and India and South Korea and many other places. And while they've been deployed at a very large scale, there have also been a number of concerns around the privacy issues concerning these apps. In particular, what type of data is being collected, by whom, and could it be used or abused for sort of purposes beyond the original public health motivation. And so with these concerns in mind, I wrote in early March an article on Medium, where I posted about 2 different protocols that could be employed to preserve privacy while allowing mobile devices to log contacts with each other, and how the system could also be used then in conjunction with help from a public health authority to notify those that might have been in contact with someone that's infected, so that they could take measures such as self-quarantine or getting tested. So this is kind of an illustration of the schemes that I described in that article. In both schemes, there is some form of pairwise anonymized beaconing. And in the simplest case, what is being beaconed is a random message. And anyone that is within Bluetooth range of this node that's beaconing would be able to hear and record, and vice versa. So they could essentially exchange these randomized IDs with each other. And later on, when one of these individuals happened to be infected, then with the aid of a public health authority, this certified sort of infection would trigger the movement of anonymized messages to a third-party server, and then other devices could check with this third-party server if the information contained in what was uploaded from the infected patient's device helps them determine that they might have been in contact with an infected individual. The whole system is anonymized so that no actual names are revealed at any point. There's a lot of places where you essentially opt in, whether you're going to share this information with the public health authorities and that trusted third-party server or not. And the ultimate step of checking if you've been in contact with someone can be done completely privately without revealing your identity. About a month after this article was published, Apple and Google announced their collaboration to deploy such technology in the form of APIs that would be interoperable between Android and iOS. Minutes before their announcement in April, I received a call from someone at one of these companies who informed me privately that they had been informed. They had read the article that I mentioned and they had been informed by it. And if you actually look at the details of the protocol for exposure notification that Google and Apple have developed, it looks very similar. Alice and Bob are having a conversation. Their phones are exchanging anonymized identifier beacons. And if Bob happens to be positively tested in an app from a public health authority, that with his consent, essentially uploads the data that's logged in Bob's device to a server. And now Alice will be able to check privately whether she has been in contact with someone, doesn't necessarily know who it is, that might have been infected over the past, say, 14 days. And these are some of many, many efforts that are happening around the world from researchers and developers alike on developing privacy-sensitive mobile contact tracing apps. I myself have been collaborating with a group based in Europe and Brazil. And we are also maintaining a list of more than 50 contact tracing apps from around the world. And they vary quite a bit, perhaps, in how much privacy they provide, what type of information they collect, and exactly how they work. But certainly you can see that there's been a number of such efforts. One additional direction here that we've been engaged with at USC is using the data when two nodes are within range, not only to determine that there is a contact and how long it is, but also, if possible, estimate the distance between the individuals, because that might give you a better idea of the risk associated with this particular proximate contact. Now, there is certainly still a large number of questions around privacy that remain to be addressed. And there's a fantastic article by the Electronic Frontier Foundation that I highly encourage everyone to look at. And they lay out a number of principles and safeguards that should be in place for the use of digital contact tracing apps. And they mention such principles as consent. Are you making sure that whatever data you're collecting from someone is with their consent? They talk about the principle of minimization, which is this notion that whatever information you collect should be the least amount of data that you need in order to achieve the goals of the application. There should be security and transparency in terms of using open source and auditable code so that there is no vulnerability in the application itself and the possibility of data leaks. And also to address the concern of bias so that whatever technology is developed doesn't leave out a significant portion of the population without access to that technology. And finally, the principle of expiration, which is that any data that is collected essentially be deleted after a period of time when it's no longer needed for the stated public health reason. And I think in this light, something that I've been thinking a bit about is also the question of, when you say consent, what is the form in which you obtain that consent? There's this study that was done of European countries with respect to opt-in versus opt-out for organ donation. And what it found was that countries in which the default was to opt out have much higher consent rates than countries in which the default is to opt in. And I think when we are talking about situations where lives are at stake, we might want to balance this consent and maybe tilt that balance a little bit more towards opt out rather than opt in, if we really care for a significant fraction of the population to adopt the technology and use it. So to summarize, I think digital contact tracing and exposure notification tools are going to become increasingly important in the fight against COVID-19. And I do think that, while we've emphasized digital and mobile tracing techniques in this talk, we do need to combine them with more manual approaches so that the most vulnerable populations and locations can be addressed with targeted interventions. And I do think that, again, while I've emphasized in this talk perhaps the privacy that is to the extent of keeping everyone as anonymous as possible, I think there is a broader discussion to be had about whether for a limited time we should allow, with the safeguards like data expiration, the collection of more privacy sensitive information such as location and contact information in order to give public health authorities more tools for some of the manual efforts. And also, I think a topic for discussion is whether we can lean more towards opt-out rather than opt-in in the interest of public safety. So I think these are some of the issues that are still very much open, and there are different efforts that are finding different points in the design space, but it's ultimately up to the public and informed public to have a discussion about what we should adopt, and we need to do this very quickly too. So I hope this is informative. Thank you.
Well, this is Carl Mannheim. In our breakout room, we had a lot of discussions on the trade-off between privacy and ability to actually do effective contact tracing and using that information, let's say, to authenticate people for access to social spaces. And we were trying to come up with solutions where we could balance the two, such as restricting access to geolocation information. So yeah, I would like to ask the professor whether there are some solutions that haven't yet been explored that could enhance the utility of the contact tracing apps, and at the same time trying to preserve as much individual privacy as possible.
Right. I mean, so this is the core of it, that there's clearly a trade-off, right? There's a spectrum. You could do the Google Apple approach, which is very heavy on the privacy end, and it's just logging contacts. It's anonymously logging that. The only time anything gets revealed is if someone gets sick, then the public health authorities know who is sick. The others that figure out if they've been in contact with this person are not known to the public health authorities, and unless they were to go get themselves tested, won't become known to anyone. So it's like extreme on the privacy end. It's like very, very minimalist in what data is collected. But if you go to the other end, you might collect, for example, location data, because you might want to know, are there particular hotspots where infections are spreading? Maybe it's a restaurant that's operating with very poor, hygiene and social distance practices that might need to be regulated. But then that would require maybe more location information to be collected, right? Or what if you want the public health authorities to reach out to someone that is suspected of being exposed and communicate it to them in a way that doesn't make them panic, finding out for themselves that they may have been in contact. But then you need to provide contact information and even, potential people that might have been infected. And so it's like, that's a lot more information. Now you need location information, you need contact information. And so how do you do that end of it with attention to privacy technically? I mean, there's some research ideas around location privacy and zero knowledge proofs and things like that. But I'd say nothing that's sort of easy or ready to ship out in the short term. And so it's like, ultimately, I feel like a lot of this decision is about how much do we trust the public health authorities with this information and to use it only for this very specific purpose that it's intended for, right? And if that trust exists, you might be willing to share more. And if that trust doesn't exist, then we're kind of stuck with the Google Apple type of, very minimalist approach. But at least, you have some level of confidence that on the privacy side, there's very little that's being collected.
Well, let me ask about a specific application, because I also teach at a university, and we're trying to decide what to do for fall semester, right? Whether we're going to be completely online again, or have some type of residential classes. So it seems to me, if you're going to pursue the latter option, that some kind of robust contact tracing is going to be one of the ingredients, and that maintaining complete anonymity kind of defeats the purpose. And so just from a practical level, in order for our institutions to reopen, it seems to me that we're going to have to make some compromises on the privacy side.
Yeah, and you know, there's legal dimensions to that. You know, what can an employer mandate? So they could potentially say, you need to turn on this app whenever you're on our premises, but can they mandate that you keep your app turned on when you're in the weekend, whatever you're doing? I don't know. Right, so I think it's, yeah.
I have a question related to that. So you said specifically about how much trust we have in the public health officials. Now our system, our breakout was definitely talking about trust a lot. Are there different kind of variations on who owns the data? For example, if I was walking down the street and had it turned on with my iPhone, would I get information that somebody I had just passed, somebody that, you know, might have been exposed to somebody? So where it's on me to be able to figure out who I've seen, who I might have talked to. It can also be, it could be corporate agencies where they're using some of these APIs for testing their or tracking, testing their employees and workplace safety. It could also be in the hands of the public health authorities. And so LA County, you know, I think they've done a really good job from what I can see as a LA resident. Federal government, whole different story. So are there different scenarios for who owns the data and who has the responsibility for the information relaying and that type of thing? Can you talk about that at all?
Yeah, absolutely. So I think the short answer is there are many different models. It's not clear which one we're going to end up seeing adopted at large scale. There are models that are, so the Google Apple model, for example, I just laid out, is completely private information. Even the public health authorities don't know what data is collected between nodes unless someone comes in and says, I'm sick, then they know this person is sick. That's the only information they know. And they are, in their current model, saying there's one app for a whole country, unless that country wants to do it state by state, in which case they have to go to Google and Apple and work with them. And that might happen in the US, I don't know. So that's one model, right? Very limited types of data that are available to anyone at all. Like no one really has the information about exactly who met whom in the Google Apple model. A different model might be very local, what Carl just brought up, like a particular company, a university, mandating that everybody that is a student, for example, faculty, staff, must install a particular app that is collecting more specific information, that is collecting information about locations, that's collecting information about who they are, ways to contact them. And they've set up this app in such a way that it goes to their backend, and this organization essentially has access to the contact information. They make it available to the local public health authorities, whether it is the county level or even within the university. For example, you know, at USC, we have a student health that's now serving as the kind of university coordinating body for everything COVID related. So they might have access to the case information, who has met whom, et cetera, right? So I think there's a range of different models. It's not clear what actually will get adopted, what will be the legal challenges to the different models as well, because some of them are more invasive than others.
And what's your opinion on it?
I've evolved my own thoughts. I think I started out from being on that very heavy privacy end of the spectrum, the kind of Google Apple approach that was talked about. So in March, when I wrote the blog article, that was the scheme that I outlined as well, right? So and folks at USC reached out to people at Apple and Google, and I got some feedback saying they were informed by that writing. But over time, as I think about kind of this trade-off between what data you're collecting, what's the purpose for which you're collecting it, and this is, you know, the public health interest, I think there is an argument to be made that we could go for more information that's helpful to the public health authorities. And I think location information and the ability to contact individuals and communicate with them the specific risks they may have, but having somebody competent contact them rather than just an app tell them you might be at risk, I think there is a benefit, public health benefit to that. But so long as the other concerns are still met, so are we making sure that the data will really not be used for other purposes? We're allowing medical authorities to collect private data, but under HIPAA regulations, right? So could we have something that's that level of, guarantee that your data is being used for your health? And can we do it in a way that's less opt-in, perhaps? Because as many cases have shown, if you require people to do something, just a little bit of friction, even if they agree with the overall interest, they may not do it. And someone brought up in our breakout that Singapore has like 10%, 15% downloads of their contact tracing app. And this is a country where I think people generally, are maybe a little bit more on the community interest versus individual freedoms end of that spectrum. But even there, you're not seeing huge adoption because of just the friction of having to go download an app. So I think I've found myself shifting more towards something that is somehow required or mandated, but just with a lot of the privacy settled by legal backup.
Okay, I have a question. My name is Vidyangi, and I just wanted to find out what are your thoughts on Kerala in India. They have managed to flatten the curve and they have gone aggressive on contact tracing. I don't think they're all that high tech, but they have been fighting pandemics for a long time now, because it's a state where they often get into a pandemic situation. So they have operations which is pretty resilient, but they're not very high tech like Singapore. And I've heard good things about Goa in India. So these are all emerging markets. Right. That's one question. And I just want to inform the group that MIT's COVID Safe Paths, or the website is covidsafepaths.org. They've come up with a deep learning algorithm which is better than the Google Apple algorithm. It works with the Google Apple algorithm. It shares information but not identity. It's called split learning. It's beyond federated learning, and it's covidsafepaths.org. A lot of governments are registering because it's open source. You can customize it to your organization. Anyway, so what do you? So going back to my question, what do you think we can do with bare bone frugal innovation, not like high tech? What we can do?
Yeah, honestly, that's the default mode for public health authorities. Contact tracing, as I mentioned in the talk, goes back to the 1930s. The standard way of doing it is very manual. You just have, literally teams of thousands of individuals that are keeping track of the cases, go out door to door in some cases.
Right.
This is happening in India. They make phone calls, but it's just a very manual intensive operation. It's also being done in, I want to say one of the states in the US, was in New York or somewhere in the Northeast. And that's like the default that I think, particularly if you start that early enough in the process, you have some hope of even containing it very early, right?
Yeah.
Manual intensive, but the scale isn't so high to begin with. If you're in a situation, I think we're already in several places, although maybe by the end of summer, maybe we're back down to some reasonable numbers. I mean, it's an option. It's certainly an option that many public health authorities are inclined to take because they just generally don't have the same level of comfort with technology that engineers and people in Silicon Valley generally do, right? And so, and especially all the problems with adoption, that might actually end up being the thing we resort to in COVID-19. So maybe, until the next time we have an epidemic, this may be the way we end up dealing with it this time around.
Right. So they have shut down people coming into Kerala and going out. That is one thing. Another thing was, as soon as the first infectious disease case was registered, the hospital alerted all the hospitals in the state. So that's what they did differently. And after that, within a few days, they were completely locked down. And everybody thought this was insane. Just one case and why are you in a lockdown? So the Kerala authorities said, we know what we're doing. We've been in pandemics before. And they've been pretty headstrong. They have a communist rule there. Nobody opposes the government. So this seemed like an insane thing to do, like one case and you shut down everything. But they were too familiar with pandemics. They've lost a lot of income, a lot of jobs, and Yeah, I guess we have to work with public authorities and make it work. I guess that's the way to go.
I saw a question earlier from Annie.
Yeah.
Sorry, I think you're on mute.
Hello. Hi, Professor. Kind of to piggyback off of what people have said earlier, especially what Karen was saying, coming at this from another angle, what would you suggest for organizations to cultivate a culture in terms of the people handling this data to behave in such a way that is, you know, taking into consideration the ethics and privacy concerns? Because the way I'm seeing this is we can have mechanisms in place, we can have the ways that the contact tracing is undertaken, but ultimately the agents responsible behind such great power, what are some ways perhaps you would think of cultivating an organizational culture, whereas it's done in good faith? Because all of this talk about Singapore as well made me realize in other parts of the world, and I'm not just talking about collectivist or individualist mentalities, but you have things like intelligence agencies in Israel who are teaming up with the government. So it ultimately, I'm curious, and what our breakout room briefly touched upon was how, when it comes to the agents responsible for this, would you think about cultivating a culture of responsible ethics? Because you can't always control who's doing what, but you can try to cultivate trust in an organizational culture that's responsible for it. I hope this makes sense.
I think fantastic question. So just a couple of comments and thoughts. One, of course, is that you do need, you know, even if it's a question of ethics, you need training. You need people to be sensitized. You need this to be top of mind. You need them to be exposed to the best practices associated with, you know, keeping data secure and private and so on. There has to be legislation with enforcement teeth for people that violate the privacy laws. And I think the other interesting concept I've heard, I haven't looked into it very, very carefully, is this notion of a data fiduciary. Someone that handles your data with your interest in mind rather than their own, right? So the way we have fiduciaries for financial management, what does that look like? I don't know a whole lot about the subject, but I thought as a concept, it sounded very interesting, that there may be analogies there to draw on. And I totally think, yeah, having your intelligence agencies do your contact tracing for you isn't the way to go. They tried it in Israel, actually. The Supreme Court in Israel disagreed and shut it down. So as of now, they're not using kind of intelligence data to track COVID cases anymore.
Thank you.
Chris, Jax, do you have something to say?
Hi, actually, this is Stanley Bishop, and Todd, your beard is looking fabulous.
Thank you.
Professor, we spoke a month or two ago related to a project called Halograph, and I wanted to thank you so much for both having the conversation and sharing your research groups per neighborhood infection rate data. We've successfully written that into a graph database and also pushed relevant LA Civic data sets, and we're doing a deep learning driven discovery process on it currently, and it's really a fun project. So yeah, definitely wanted to jump in and thank you. Also curious if you have any perspectives on applications of holomorphic cryptography to anonymous federated learning systems.
Homomorphic encryption? Do you mean homomorphic encryption?
Yeah, that's what I meant to say.
Yeah, secure computing approaches. Yeah, I think they have a role to play. Essentially, this is the notion that you can give your data somewhere to be computed on a third-party server with the guarantee that your data is encrypted even from the owner of that server. And I think it might have a role to play, you know, if you have a very clear idea of what computation you want to do on the data, and you want to make sure that you're able to get the computation to be done, you know, on a server in a way that no third party has access to the data itself, and in some cases even the results of the computation, or even what the computation is. So I think it has a role to play. It's a building block, is the way I think of it, you know, among many building blocks that applied cryptography gives us. But for the very specific application of contact tracing, I think there's just a couple of places where it's not just about cryptography. It's like, are you going to collect location data or are you not? You can't completely anonymize saying this is happening at a particular restaurant. Like that's just what you need to know, right? There's no point encrypting the fact that, because you can have health inspectors or people, enforcing the law on social distancing going to an encrypted restaurant. There's no such thing, right? So there's places where cryptography is not the answer, and that's the part which I think people are struggling with a little bit, because then it's a trust issue, and the fact that it's only handled in the right way. And so it's like, cryptography is absolutely fantastic, and I think the cutting edge of that is constantly giving us more tools, whether it's zero knowledge proofs or homomorphic encryption. I think we are going to end up in a more privacy sensitive and secure world than we have been in the last 20, 30, 40 years with information technology, but it's still not going to be the answer to every problem of trust that we have, right, depending on the application.
Wonderful. Thank you so much.
Any more questions or any more discussion here, or we're good to go? We'll be uploading a copy of this talk on your YouTube channel. Oops, not that one. Yeah, I guess if there's nothing else, you guys.
I would talk about one more question. Just
go for
it. There's this new result that's finding a curve correlation factor of p equals 0.96 with COVID viral load in sewage, and then a week subsequent test results. I was just curious if you had a reaction to that.
Yeah, I saw something about that too. Fascinating. I know people already in organizations that are looking at putting sensors in their sewage feeds. It's interesting. I mean, if it's giving you some aggregate signal that there is something to be concerned about, and all it's doing is just triggering that, it's not telling you exactly who. I feel like it's a useful tool, and again, what more steps are taken beyond that, hopefully are all within, legal means, etc. But as an indicator of, is there something to be concerned about in a certain community, because we've monitored the sewage from this community and it's suggesting significant active infections. Sounds like it could have a role to play. And I think from an IoT perspective, it's fascinating too.
Wonderful, thank you.
I had a question on the Google Apple approach. What kind of uptake is really necessary for people to be able to effectively rely on it? What's the uptake percentage? Has anyone really looked at how many people they think they're going to need?
There was an article I saw from UK that indicated you need about 60% adoption. But given the numbers out of Singapore of like 10-15% people downloading and installing an app, that's looking very, very challenging. My own sense of it is that any information is better than none. So if I have an app and it just told me that I was near someone that is known to be exposed and I should take precautions, I feel like that's useful. If only 2 people in all of LA County had and one of them got sick and I happened to be near them and the app told me, I feel like that's better than nothing. But of course, the more the better. And so it seems like 60% is like the magic number at which it starts to look like really useful. But I feel like all the way from 0 to 60, there's some value that's increasing.
Does their tech allow them to be able to determine what uptake they've got?
That's a good question. I think it's just an app install, so they'd just be able to detect how many people have installed an app. That probably is something they'd have access to.
Do you know, in the US, is that going to be state by state, or is it going to be a nationwide thing?
I just don't see how they're going to do it nationwide. I'm skeptical myself. I don't know that there's been a move towards it, because so the way Google Apple have set it up is they say it is one app per country, but if countries want to do it state by state, they need to work with us. So we don't know yet. I think it's the short answer, but I would think that US is one of the few places where it has to be state by state, but I don't know.
Thanks.
Great. Well, thank you. I definitely, I found the interaction very helpful, both in the chat and these questions. Really appreciate it.
Yes, thank you, Bhaskar. Thank you, everyone, for showing up today. We will, again, be uploading this to YouTube by tomorrow, and hope to see you at one of our other events. We've got the book club. We're starting up a book club, and that will start up on Sunday. And so we'll discuss what books, how we want to structure it, and we'll kind of vote on what our first book we'll be reading in June is. And so hope to see you all soon, and have a great rest of your day. So thank you all.
Bye.
Bye, guys.
Thank you.